Once every month or so, the good folks at Triad Federal Credit Union and High Point Regional Health System help us deliver some healthcare news and keep you abreast of what's going on. And one of the things we wanted to tell you about is physical therapy, speech therapy, rehab for pediatrics. And let's meet our guest. Katherine Kesslick is next to me. Next to her is Heather Schwartz. Now, Katherine is a physical therapist. Heather is a speech therapist. Welcome, ladies.
Thank you. Thank you.
Happy post-Valentine's Day. We've just come out of Valentine's Day week. What is pediatric rehab? Who wants to handle that?
I'll take that one.
All right.
We provide physical therapy, occupational therapy, and speech therapy to children ranging in age from birth to about 10. And we see children with a variety of developmental disabilities, including autism, cerebral palsy, children who are born prematurely, children with orthopedic and neurological issues. We do a lot of parent education. We try to involve the parents. And you do this in
that facility in High Point, right?
Yes, we do.
Now, how does someone, I don't know if I want to use the word qualify or register, I mean, how do you determine who's going to come in and be part of the rehab program?
Most of our referrals come from pediatricians.
Gotcha. Okay. Now, you talked about various conditions. What about services? Can we pinpoint some of the exact services that you guys offer?
Well, we provide physical therapy, occupational therapy, and speech therapy.
And when somebody says occupational therapy, I think I know how that relates to an adult. And I'm putting you on the spot because we didn't rehearse this, I know. But when we're talking about children, what the heck would occupational therapy be for a child? I'm just going to ask the stupid question. Go ahead.
That's a question that we get asked a lot.
And you just got asked this time, too.
A child's occupation is play. So they're helping a child learn to play. They also help a child learn to feed themselves,
gotcha.
Learn to use their hands to play with toys, fine motor skills. Occupational therapist looks at sensory integration.
And you all do such a great job over there, too. I'm just really proud of what you're doing. But I want to ask the obvious question, too. What makes what you're doing special? How is it different from other facilities that they're doing this?
Well, we have a large area that is just for pediatrics. We're separate from the adult therapies that are in our building. We have a large open gym that's primarily used for physical therapy and occupational therapy, and we have several private treatment rooms. Our speech therapists are in private treatment rooms, and our occupational therapists and physical therapists use the private rooms if they need to avoid distractions, because with lots of children in the area, we have lots of distractions.
Are there any, we've talked about some of the various modalities that you're offering. What about any special programs? Anything special that you're starting up or have been doing recently?
Well, we have something that we have for physical therapy. It's a partial weight-bearing gait training system. It's a suspended harness that is up over a treadmill that we use to help children learn to walk.
Isn't that great? We
have a pool for aquatic therapy. We have several different types of swings that our occupational therapist uses for sensory integration.
And of course, we've talked about speech therapy. We have a little bit of time left. I just want to ask a personal thing of Heather. Why do you like doing this kind of work?
It's very rewarding. Every day is different. It's a challenge every day. Every child is different, so you're constantly trying to figure out what works with the different children. So, but very, very rewarding working with the children and the families.
How can folks get in touch with you all about this specific program? I know we'll put things up on the screen now. I think is maybe the High Point Regional Health System logo and also the Triad Federal Credit Union. But specifically, is there a different number or something people should contact?
The number directly to rehab is 878-6915.
Well, again, I salute you all for doing what you're doing. It's great work, and it needs to be done, and you're doing a great job at it. Thank you. Will you come back sometime?
We will.
Sure.